Bismillahirrahmanirrahim. I welcome all of you, both the groups, Group A and uh, Group A from morning and the evening. And in today's practical class, we will be discussing a very important aspects of the anesthesiology, that is the equipments and drugs. And usually today, in today's discussion, I will be introducing you the different equipments which are used for anesthesia machine, and then in the next practical class we will be discussing the different anesthetic drugs and ultimately the patient monitoring. So I can start that this is the scope of this presentation. I will start with the breathing circuit and then the anesthetic drugs, yeah, including the pre-medicating drugs, inductions, and maintenance drugs. And then I will be focusing on the monitoring of the patient, that different parameters are different clinical parameters, different lab parameters which are used to monitor the patient when he is in the stage of the anesthesia. And so we have already uh, practically covered this topic of the gaseous anesthesia machine, and this that gaseous anesthesia machine. This is a very important component of your operation theater, and keeping in view the importance of your clinical practice in small animal as well as the large animal practice. Now the people, they are preferring the gaseous anesthesia as compared to the injectable anesthesia machine, injectable anesthetics, because of the low risk of the gaseous anesthetic agents and because of the quick response in reversing the recovery of the patient. So we have already introduced the gaseous anesthesia machine, and we already have a gaseous anesthesia machine in our operation theater. So the gaseous anesthesia system, it is composed of different things. Like start with the gaseous source. So this is the gas source, which is consist of a tank. It may be depending upon the capacity of the tank. It may be the H tank, mean huge tank, or it may be the E tank, I mean the emergency tank, which is mostly kept in the operation theater. And in a bigger setups, you know that the huge tanks, they are connected outside of the operation theater, and the supply of the oxygen that is carried out into the operation theater, and that is connected directly with the anesthesia machine as well as connected to the different beds of the patients where they are requiring the oxygen supply. So we know that this gas source, that is a high pressure tank, and when they are filled, they contain huge psi or Pascal pressure within it. It can range from 1500 to 2000 psi. So this psi is quite detrimental if you release this outlet of the this gas tank, so it can fly like a missile. So that's why we have to reduce this pressure of the gas, this tank, to that level where depending upon the capacity of the lung that it can accept it. So that's why we have some valves which can reduce the pressure, this high pressure into a normal limit. So we can have I mean low pressure or pressure reducing valves which can reduce this 2000 psi to 50 psi. Similarly, we have the low pressure system, I mean in the form, further low pressure system in the form of the flow meters and in the form of the vaporizers. And similarly, we have the breathing systems, and this is the system which is responsible for further carrying out of the oxygen and the anesthesia gas, or you can say the medical gas, and that is supplying to the patient. And similarly, the scavenging system, which is uh, pouring, or which is eliminating the unused or usable or non-reusable gases to the outside of the environment. And then we have the waste gas evacuation system. So this is the main flow sheet diagram, which is showing your anesthesia system. And this anesthesia system, so these are the basic principle of the anesthesia system, and starting from the supply of the gas and ending with the waste of the unused or non-usable gas. So this high pressure component, it composed of these regulators, and when your gas tank is filled, these regulators that will be showing the this picture that will be showing the quantity of the amount of the pressure that the container. So the high pressure means there is a huge quantity of the oxygen that is available within the tanks. So they are connected with the pressure regulators, and they are connected with pipelines and houses. They can further supply or carry the oxygen from the tank into the machines. So this is the house or lines or pipeline that is the oxygen pipeline. Similarly, some anesthesia machines, they have the similarity that in the same way like in the anesthesia machine, in which we can one side we have the oxygen supply connection, and on the other side we have nitric oxide uh, connections. Now come to the low pressure system. From high pressure system to low pressure system, it is contributed by two things. One is the flow meters. So it further reduces the pressure of the oxygen from 50 psi to 12 to 15 psi, and that is the psi which is acceptable for the lungs of the patients. And similarly, we have another part of the low pressure system, that is the vaporizer. So vaporizer is the part of the anesthesia machine in which the oxygen is mixed with the liquid anesthesia, and it is turned into vapors. And that vaporizer, they are further classified into you can say the calculated vaporizer, in which we can give uh, we can mix the anesthesia in the oxygen as per demand, or as per the calculation, or as per the minimum alveolar concentration that is required by the patient. And finally, next is the breathing system. And breathing systems, they are further classified into four categories, like open breathing system, the semi-open breathing system, and semi-closed breathing system, and the closed breathing systems. So all these breathing systems, they have their uh, own importance. They have their own plus points and the negative points. So I will be giving you the brief introduction of all breathing systems. First is the open breathing system. As the name is showing, open breathing system in which there is no reservoir. As we have seen in our anesthesia machine, that we have a reservoir or a rebreathing bag, and that is the bag that in which the excess quantity of the oxygen or gas that retained. So in the open system, you cannot find any reservoir bag or reservoir gas mixture, and there is no rebreathing of the expired gas. Similarly, in our anesthesia machine, you have gone through with it in the closed system, that we have rebreathing of the expired. The expired gas mean that the carbon dioxide that is absorbed in the CO2 canister, and the medical gas that has been that can be reused again in the circle. So in the open system, there is no way that we can reuse the medical gas again into the system. So this is the example of the open system that you can see, that is a big jar, glass jar, and we have soaked the anesthesia mixture in the cotton, and that has been kept in the, and the animal that is placed in the jar, and it will inhale the anesthetic agent, and ultimately it will be anesthetized. So this is the example of the open system, that we can use the plastic jar and we can place the anesthesia, and ultimately we can make the, so usually this set of systems that is used for lab animals for a shorter duration of time. If you are going to work on the lab animal, you want to get the animal to become desensitized or become generally anesthetized. So this open system that is used for lab practices like for mice and for rodents. The second category of the rebreathing system is semi-open. In this system, this is a clinically used system. We are using this system in our clinical practice as well. That this system has reservoir. Mean the system would definitely be having the reservoir bag within it, and like yes, and then no breathing of the expired. So in this system, you cannot say the reuse of the expired gas. So we don't have any pipe for the expired gas. So expired gas would be released directly into the environment from the patient. So we don't have any channel in which the expired gas or gases containing the anesthesia plus the carbon dioxide that could be withheld in the channel. So it don't have any channel or any pipe for the expired gases. And so no carbon, that's why there will be no carbon dioxide absorption. And this is the non-rebreathing system. So this is the example of the non-breathing systems, semi-open system. So what we have facility that this is the tube that can carry out the oxygen or carry out the medical gas, right? And that is directly connected to the patient. This tube can be connected with the endotracheal tube, and we have reservoir. So the extra oxygen can be stored, so we can access the pressure of the system with this reason. But for the patient, there is no channel. There is no channel for its you can say the rebreathing reservoir. So no rebreathing system is present in this system. So the patient will expire the gas, and that gas would be expired directly into the environment, right? So this is called semi-open system, in which the system is only having the inspiratory system, but not for channel for the expiratory system. Semi-closed, in the system, it has the reservoir, it has the partial rebreathing of the expired gas. So now this is the additional that we can have the channel for the expired, but it is the partial rebreathing channel. And it also have the system for the absorption of the, so we have carbon dioxide canister in this system, and it can absorb the carbon dioxide, and it can make the availability of the medical gases to be reused again. So this is the circular breathing system with low to high gas flow. So you can see in this picture, uh, uh, this is the oxygen supply, all right, and this is the vaporizer. Oxygen is mixed in the vaporizer, and similarly we have the Y shape, and okay, and ultimately we can have the facility that the expired air that can be held within it, and even it can be released. So closed system, this is similar to the semi-closed except for the oxygen flow. So oxygen supply equals animal's requirement. I mean, in this we can we have the calibration of the oxygen supply, and we can flow the oxygen according to the requirement of the patient, that is from 6 to 8 ml per kg per minute. So in our clinical practice, the most commonly used breathing systems are non-rebreathing system and circle breathing system, or this is called the closed breathing system, and this is called the semi-open breathing system. So mainly these two rebreathing systems, they are being used in our clinical practice. So you can see this is the example of the semi-open or non-rebreathing system for small animal practice, then having 7 to 10 kg body weight. What we use that we can. This is the pipe. This is the pipe that is the source of the medical gas as well as oxygen, and the animal that is this outlet that is connected with the endotracheal tube, and the animal now can expire directly into the environment, but it can receive the oxygen, it can receive the medical gas from uh, this this tube. So the advantage of the non-rebreathing system or semi-closed system is semi-open system is less dead space, mean there is a no resistance, because कि हमारे पास जो है वो इनहेलेशन तो फुल होती है लेकिन एक्सेल करने के लिए कोई ट्यूब नहीं है. सो there is a no less dead there is a less dead space, there is no resistance to the breathing. So, but in case of the non-rebreathing system, we have this Y-piece breathing circuit, or इसमें we can see a dead space because our inhalation and exhalation that is totally within the circle, that is totally within the system, and sometimes the pressure of the system can increase and we can offer us resistance to the breathing. So this is about your breathing systems. Basically, there are 4 breathing systems, and inshallah, in our coming practical class, we will be discussing the different drugs which are used as a pre-medications, which are used as anesthetic drugs, or which are used for the maintenance of the anesthesia. Thank you very much for your patience.